Disorders of the gastrointestinal tract. Constipation. In general, constipation refers to bowel movements that are infrequent or stools that are too difficult to pass. And there is great individual variation in normal bowel habits. Therefore, emphasis should be laid on changes in the normal usual bowel habits. Diarrhea alternating with constipation may indicate a large bowel cancer, especially for those aged 40 years and above. But in children and elderly, it may indicate chronic constipation with spurious diarrhea. The habitual use of laxatives is very common, and the practice should be discouraged to avoid hypokalemia and its consequences. So the medical causes of constipation include diet deficient in roughage, ignoring the urge to defecate due to immobility, hypothyroidism, irritable bowel syndrome, hypercalcemia, and drugs like atropine, cocaine, morphine, tricyclic antidepressants, and disopyramide. Also, lazy bowel from chronic laxative use, including herbal preparations, can cause constipation. Lack of exercise, dehydration, and starvation, particularly in children. So the surgical causes include gastrointestinal obstruction, anal fissure, and other painful perianal lesions, carcinoma of the rectum, and sigmoid colon, foreign body in the gut, pelvic mass, for example, fibroid, also fetus too, and aganglionic and acquired megacolon would cause constipation. Pseudo bowel obstruction, as Ogilvy syndrome, following immobility from any cause could lead to constipation. So the symptoms include inability to move bowels, passing hard stools, infrequent passing of stools, straining to pass stools, and feeling of incomplete evacuation of bowel, and inability to pass flatus, and also colicky abdominal pain with or without vomiting may be present. So the signs that are usually elicited are frequent high-pitched bowel sounds, and if this is present, suspect mechanical bowel obstruction. Also, there could be absent bowel sounds, and in this case, suspect paralytic ileus. And then signs of peritonitis may be present, which could include generalized tenderness, garden and rebound tenderness. So, in this, suspect gangrenous bowel. So the investigations include digital rectal examination, and it must be carried out in all patients with suspected diagnosis of constipation, and stool for occult blood, and plain abdominal X-ray, erect and supine, and proctoscopy, protosigmoidoscopy, colonoscopy could be done, but it must not be done if acute intestinal obstruction is suspected. So for the treatment, the main treatment objectives are to identify possible cause of constipation, to relieve constipation. So non-pharmacological treatments include adherence to regular exercise, high fiber diet, and adequate fluid intake. Minimum of 3.2 liters of water per day if no contraindications exist. So for pharmacological treatment, the first line treatments include bisacodyl oral, that's 10 to 20 milligrams at night, or Sina. Yes, Sina oral 15 to 30 milligrams at bedtime, with a maximum dosage of 70 to 100 milligrams daily. Doses above 70 milligrams should be divided 12 hourly. Or you could also give lactolose oral as 15 to 30 milliliters daily until response, then 10 to 20 milliliters daily. For second line treatment, you could give bisacodyl rectal as 10 milligrams in the morning, or glycerol suppositories, that's rectal, 4 grams at night, or liquid paraffin oral 10 to 30 milliliters at night, or even milk of magnesia oral 5 to 10 milliliters in a glass of water 12 to 24 hourly. That's for the management of constipation in adults. So for the management of constipation in children, first line treatment, you give lactolose oral between age 10 to 18 years. You give 10 and 15 milliliters orally. From ages 5 to 10 years, you give 10 milliliters orally. And 1 to 5 years, give 5 milliliters orally. And less than 1 year, you give 2.5 milliliters orally. Or you could also give glycerol suppositories rectal, ages 2 to 5 years. You give 2 grams at night, and less than 1 year, you give 1 gram at night. And for bisacodyl rectal, you give 5 milligrams in the morning. That's for children above 10 years, and below 10 years, you only give on medical advice only. Or you could also give Senna oral from 6 to 12 years, 5 to 40 milliliters at bedtime, and 2 to 6 years, you give 2.5 to 20 milliliters at bedtime. So do not use milk. Do not use magnesium salts in patients with impaired renal function. Yeah. Okay. So referral criteria. The following categories of patients should be referred to a surgeon. So patients with absent bowel sounds, as vomiting or not passing flatus, or cases resistant to medical treatment, or any suspected surgical cause.